for the Preventive Medicine Center and Hartford Public Access TV. If you have any questions about this program, please call me at 549-3444, and I'll be glad to answer them as best I can. Today I do not have an organized theme, but I will tell you the organized theme that I'm thinking about. It's called hypertension. I heard an utterly astounding talk that I'm not sure it bothered or affected people that much recently. A Dr. Joe Izzo, who is from upstate New York, was here talking at the Robert Silverstein Cardiology Symposium put on by St. Francis Hospital, and in it he spoke about the origin of hypertension. Now, this is a very smart man, and I must say that when he finished talking, I wasn't quite sure what he'd been talking about because I had a little hard time following it, and it's not because it was over my head, even though to a certain extent it was. And let me tell you, if it was over my head, it was over almost everybody else's head, because I really do understand hypertension. But he raised a kind of a mind-splitting idea, and that is we have a very sort of clear idea in our mind about what causes high blood pressure, to which his response was not in these words, but is in my words, that's hooey. In other words, it's not quite so clear what causes hypertension. And he was saying hypertension is different in the younger people from the older people. And that was an interesting idea, that it's sort of not even the same disease. We all think about weight and diet and so on, salt being the cause of high blood pressure, but it's not really quite that simple. I will say this, it does boil down to what I have said all along. If you don't do things wrong for your biochemistry, then you don't develop high blood pressure or high cholesterol or diabetes or cancer of the breast or cancer of the colon or heart attack or stroke or so on. And I'm not saying that you have to be perfect with this. There's a line from Shakespeare that I often quote, and it goes like this: "The quality of mercy is not strained, it droppeth as the dew from the heavens." And that's from a speech by Portia in The Merchant of Venice, where she's talking about things should not be stressful, they should be gentle. So when I talk about eating the unprocessed whole foods, berries, cooked vegetables, vegetable soup, bean diet with fish twice a week, and if you're not overweight, then you can have the brown rice or the barley, I'm not talking about doing it to the point where you are strained by it, but you gradually transition to this kind of thing. And as I said to many patients today, it's called pay me now or pay me later. I have one woman who's 5 feet 5 inches, came in to me, she's going to have thumb surgery, and she's 214 pounds, and that's up 12 pounds from the last time I saw her. She had a very difficult winter, and let me tell you, I was duly impressed with how well she had done keeping her head together, because it was enough to blow anybody's head apart. But my point for mentioning her is she does not answer to me. She answers to her own biology. And she's the kind of person who, as lovely as she is, she's looking for the easy way out. And we were talking about the lap banding surgery. And my point about the gastric bypass operation or the lap banding surgery is they work to a point, but they don't work as well as people think they do. Star Jones, who it's worked very well on, and I think Al Roker he's also, I think, had the gastric bypass operation. They are paying attention to their diet and exercise, and that's why their weight is down and staying down. If you don't pay attention to your diet, then it tends to start coming back. Why am I talking about this? I'm talking about there's no simple answer to the fact that you either do what you're supposed to, as I've laid out to you, because that fits with our natural human design. There are people who don't follow what I say and they look good. There are people who smoke, may use a little marijuana, who are overweight, who may exercise a fair amount and have low percent body fat, and they're getting along just fine. But if you take a look at statistics, you will find that those people who don't do it right are at much higher risk of developing the complication of high blood pressure, memory loss, heart attack, stroke, diabetes, cancer, and so on. And they will pay by seeing the doctor, paying for their medications, high health care insurance, time off from the job. I have a number of patients who come to me who are very hesitant to come to me because they've just gotten a new job or a change in their job, and they feel like they can't take the time off because they might jeopardize their job. And I can understand that. But if they were doing what they were supposed to, they wouldn't need to come see me in the first place. And you may say, yeah, I know all that. No, you don't know all that at the point where your cholesterol, when you subtract the good cholesterol from the total, that number needs to be less than 90. Your diabetes test needs to be an A1C of less than 5.5. And your 2-hour blood sugar after your meal needs to be about 90. It's more important, by the way, to check your sugars after the meals, 90 minutes after the meals, than it is really before the meals. Now, you might say, well, how am I going to calculate how much insulin I need or how much Prandin I'm going to have? There are ways to do this, but the most important thing is you don't want that high blood sugar. We are in the state where we've eaten most of the day. We're not in the fasting state. Very, very few of us are. So what you have to do is you have to look at what your sugars are after the meals. As a matter of fact, when I send my patients for cholesterol and triglycerides, I don't care whether they've eaten or they haven't eaten, because I learn a lot by seeing what is their cholesterol, triglyceride studies after a meal. That teaches me a great deal. So as a bottom line, it teaches me more than it teaches me if I know it when they're fasting. So we're getting into the better weather, and I want to show you a pair of sunglasses that are not very expensive, and they're really quite good. I think these are brown. I'm not sure what the color is, but I think they're brown. And they have little areas here on the side that are also sunglasses, and these fit over your glasses like that. I'm always having to stretch these things out. Hope I don't break them here on the television show. And these go right over your glasses, since so many people wear glasses like I do. And you just put them on like that, and then it catches the sun this way and that way, and it makes driving very, very comfortable. They're polarized, they're coated, and they're inexpensive. These things run for about $35, I think.